The EU's medicines regulator says it's found a possible link. Is this cause for alarm?
Well, it's cause for some concern and needs to be explored further. But we still need to keep it in perspective, particularly in Europe. I mean, they paused the vaccine for a couple of weeks. Yes, this might be a rare side effect. It may occur 1 in 100,000, 1 in 200,000 people if it is there. But by pausing the vaccine rollout that they did, many more people died because they weren't vaccinated, because we know the vaccine is very good at stopping people dying and getting serious disease. So if you're over the age of, 70 or 60, over the age of 70, for instance, if you get COVID, there's probably a 1 in 100 chance you will die as a result of that, along with, the serious illness. So if you're in a situation where there's likely to be a lot of COVID spreading and you're coming in contact with it, to actually put off getting the vaccine because there may be a rare side effect, 1 in 100,000, 1 in 200,000, compared to a known risk of 1 in 100 or more if you're over the age of 85, might be even 1 in 5. That is not a good decision. The benefits of the vaccine so far outweigh the risks that you'd be silly not to go ahead. And that's true for the whole population and recommending it. Now, if more data comes out and there's particular subgroups, women between the age of 30 and 50 who have a 3 times higher rate than men, and it is a higher rate than even 1 in 100,000. That's different. Then you have to look at a different vaccine for that group, particularly in Australia, where we have no transmission of COVID currently, but who knows what's going to happen in winter. So you may have to be selective in who you do it, because if you're a 30-year-old, for instance, your chance of dying of COVID is only about 1 in 10,000 if you actually get infected. So with all these groups, we need more and more data to make the proper assessment. How much benefit do you get versus the risk? Now, the risk will always be lower than much lower than the benefit, but it may be an altered equation in different groups. And again, the big advantage in Australia, we do not have transmission of the virus. We are probably not likely to get it again if we keep on doing what we are. But that gives us a chance to get all this data from Europe, America, and everywhere else, make a decision what the risks are in different groups without having to rush it. We've got a program that's going to go till October to get everybody vaccinated. And we can then make changes as more vaccines become available that we can finally import from overseas, and certain groups may be given different ones. But even the Pfizer vaccine, which is the main one put up as being safer, that has been associated with increased deaths in Norway, for instance, and even some clotting. So every drug, every vaccine we have will have some side effects, rare to be, really bad, but we've got to look all the time. How much benefit do you get from it, and stopping death, severe disease, versus the likely risk, if it is there at all?
Well, let's talk about that risk versus benefit. You mentioned some of those statistics there, but Peter, does it bring about a level of anxiousness and concern now, especially among those younger Australians?
Well, it undoubtedly will. If you look at all the media and what's in the headlines, I do think it's out of proportion, but I don't think you can ignore it. It's with all these vaccines, you sometimes see side effects that you won't see in smaller studies of only 10 or 20,000 people. That sounds like a big study. But when you roll this out to millions and millions of people, you sometimes see rare side effects. You might remember, well, you probably don't remember, in 1976, there was thought there'd be a new outbreak of influenza in the US called swine flu, a different one than what we had recently. And 1 in 100,000 people got a condition called Guillain-Barré, which is a sort of a paralysis. So this has happened before. It doesn't mean you don't get vaccines, but you've got to weigh up the benefits of different ones versus its benefit, its risks. And you may have to modify what you do in certain age groups. But overall, these vaccines have been developed faster than we expected. They're as safe, relatively speaking, as influenza vaccines, 3 times more effective against a disease that is 10 or 20 times more likely to kill you, for instance, than influenza.
All right, Peter Collignon, we have to leave it there. Thank you for joining me this morning.
Thank you.